Good evening to all of you. So today again we'll discuss about the next aphorisms of the Organon. I hope there is no doubt or any questions regarding the aphorisms which we have already done. But still, if there is something that you want to discuss or you want me to explain on something more, then you can always send me the question or the query or anything, and you can send it in the group and we can talk about that or try to clear the doubt in a more better way. So last we have done till aphorism 178. Today we will start with 179. So aphorism 179. So till now I'll just give a small this thing that we are now into the practical part of the organon, where Dr. Hahnemann has given us giving us the different scenarios where we have to understand that how we have to give the medicine. So the first scenario was that we have taken a case and there are sufficient symptoms, but we don't have sufficient amount of medicines, which is not the case today. Okay, so that scenario we cannot say that will exist today because we have number of sufficient remedies. Maybe there are few, very few or little remedies which need to be proved in a more extensive way, but I think we have sufficient number of remedies to say that yes, that scenario may very rarely fit in today's homeopathic part. Then we come to the next part where the symptoms are less, which Dr. Hahnemann has called as one-sided diseases, where the symptoms, although we have done our best, but we cannot come up with the symptoms which are needed for the prescription of a remedy. So in those cases, the first thing is, which we have discussed last time, that okay, with the few symptoms which we have, I will talk about 178 once more. It will no doubt sometimes, the word used is sometimes, that in such a case where the symptoms are few, but yes, the symptoms are very violent and uncommon and striking. They're very characteristic. In those cases, in those some cases, okay, it will no doubt sometimes happen that this medicine selected in strict observance of the homeopathic law furnishes the similar artificial disease suited for the annihilation of the malady present. So in some cases where we get very striking symptoms, very uncommon symptoms, very peculiar symptoms which belong to one of the medicines, and that medicine is given, so it basically has that power to artificially produce the disease which is suited for the annihilation. Okay? So it will remove the disease from the body and the patient will come back to the health, but it happens sometimes, and this is much more likely to happen when these few morbid symptoms are very striking, decided, uncommon and peculiarly distinctive. Okay, but and this will only happen in those cases where these few one or two symptoms, they are very striking, very peculiar and very uncommon. Okay, uh, I just had an opportunity to prescribe to a lady. She's around, I think, 85 plus years old, and she suddenly had this, although she is suffering from this chronic disease, but she suddenly in the night she had this sudden increase of the blood pressure. So there were not many symptoms which were there. There was slight spasticity of the hands, there was this increase of the blood pressure, but these are the common symptoms which you see in this, some kind of seizure or some kind of this, that the palpitation, the heart rate is increased, the blood pressure is increased, there is slight, spasticity or something like this. But when I saw the video, because with whenever uh, you are into this state where the body is in a heightened excited state, there will be some face expressions which will tell you about that turmoil which is going on inside. But on her face, she was very calm. She had this chest congestion also. She was very calm, as if nothing. Uh, on the contrary, usually her face is a little bit more. If there is some problem with this, there is some agitation or some kind of, that there is some pain or the suffering when you look closely. But at this time, the face was completely calm, very calm face. You know, we have this symptom of tranquil, as if a person is in a state of tranquilness, complete peace, complete, no suffering at all, although we can see that the body is suffering. So when this kind of symptom, now this was a scenario which represented basically a one-sided disease. Now in that kind of scenario, when you don't have many symptoms to prescribe on, but you have a very striking symptom, a very uncommon symptom, and a very characteristic thing, that in this state usually the patient should be agitated. There has to be something, on the face, some expression of pain, some expression of not being better, not being healthy. There has to be that expression. But here is this expression, that of very calm and peace. And I prescribed her opium, and she got better under that prescription. So when that kind of case is there, then yes, the medicine will act. But coming to 179, so that was sometime. 178, the word was sometime. But more frequently what happens is, however, the medicine first chosen in such a way will be only partially, that is to say, not exactly suitable, as there was no considerable number of symptoms to guide to an accurate selection. But frequently, yeah, mostly in such cases, the thing is that this medicine will be partial, and because we don't have much number of symptoms, so we are just giving a remedy which we find according to us is most homeopathic. Okay, but we have to understand that this might prove to be a partial remedy. So what will happen after the partially given remedy, as we have discussed before also? So in this case, the medicine which has been chosen as well as was possible, we have chosen as well as we could, but which for the reason above stated is only imperfectly homeopathic, will in its action. So earlier the partial remedy or imperfectly homeopathic remedy was chosen in the earlier aphorisms, because we did not had much number of medicines at that time. Now the imperfectly chosen medicine or a partially chosen medicine is because we do not have enough number of symptoms to prescribe on. So in this case, when we have taken a remedy, when we have given a remedy, when we have chosen a remedy as well as we can, what happens is, will in its action upon the disease, that is only partially analogous to it, just as in the case mentioned above in the aphorism 162, where the limited number of homeopathic remedies renders the selection imperfect. So Dr. Henneman is also relating with that aphorisms 162, where the remedy is basically partially analogous, partially homeopathic, produce accessory symptoms, and several phenomena from its own area of symptoms are mixed up. So it will produce the same kind of result, that some accessory symptoms of the medicine, they will come up, they will get mixed up with the symptoms which were already there, are mixed up with the patient's state of health, which are however at the same time symptoms of the disease itself, although they may have been hitherto never or very rarely perceived. Now this is very important thing, a differentiation from that prescription and in this prescription. So I'm just going to remind you about those aphorisms from aphorism 162 onwards. So there we had good number of symptoms, but we do not have the medicines enough which could cover, or we have not known at that time. Dr. Henneman said that I don't know about much medicines. Like I have told you also that hardly there were, I think at that time when he wrote that edition of the Organon, I think he just had 65 to 70 or 80 remedies. And he was telling us about that situation, that okay, I have enough number of symptoms, but I don't have a remedy which covers all the characteristic symptoms. I don't have that remedies. So at that time, when he will give some medicine which was very close or similar, the, that medicine will remove those symptoms, add up some of its own few, and once the action was over, then he said, okay, we will take the rest of the symptoms, we will then again prescribe one more remedy which will cover these symptoms, and then they were removed, and then he was left with some symptoms, and then some third or fourth remedy will be given. In that way he used to do this thing at that time in that case. But here the problem is that the symptoms are very less. The number of symptoms or the characteristics are not present on which a medicine can be prescribed. So this scenario can happen today also, and it happens in many cases. I've seen many cases where this kind of thing happens, and I'll give you a few examples as we go along. So in this case, when a well chosen remedy is given, what happens is, after the remedy is given, sometimes when it is not completely similar, when it is partially similar, it will come up with some accessory symptoms and some other symptoms which are of the patient and the disease, which were very less perceptible, which used to be very little in its intensity, but they will increase after that prescription. For example, I had a lady who came in the state. She would just complain about weakness. I have weakness. I get dyspnea. She was around 50 years old, I think. But she would like, I don't feel like I have the energy from past 1.5 month, and I'm deteriorating. So when we took the case, okay, any other symptoms, and many times with this kind of thing, the patients are also not in a state to tell you the symptoms which they can or which they feel, but they cannot tell you clearly. Dr. Hanuman also gives the same example in the coming aphorisms, so I will tell you when we will reach there. So she was saying that okay, I have this thirst is okay, appetite is okay, little less. So no characteristic symptom was coming out of the whole this thing. So what I could understand is that she was feeling sleepy, and she was dull in the mind, and she was not able to give her symptoms properly. She felt weakness, so I gave her some remedy. So what happened after was that once she got remedy, after 15 days she came back, and she said that, oh my god, that I am having a very bad headache. The whole cervical region and this part, it is getting very much this, like there is some swollen thing inside, there is some swelling inside, and it feels like that it will burst out. And then she told about the that I am also having this gastric symptoms, and this thing and that thing and that thing. So then I started inquiring that it's comes to you that from where did this all symptoms came suddenly? Because when we talked about the history, she never told that she used to have headaches, she used to have this. She said that, oh, these symptoms, they were very mild symptoms as compared to my weakness. They would sometimes come, not come. I never bothered about them. They never bothered me, these symptoms. But the most bothering part was weakness. So this is what happens in these kind of patients, especially who have this lack of reaction undergoing them, their states. So when you give this remedy which you feel is okay, it is not completely homeopathic, but yes, it matches some state which is there. So the symptoms, they will come up. Sometimes the symptoms of the medicine, they are mixed with the symptoms of the disease also. So what we have to do in those cases, some symptoms which the patient had never previously experienced appear, or other he had only felt indistinctly, become more pronounced. So those symptoms which were never there, like the accessory symptoms of the medicine, they will come up, or he will start feeling those symptoms more pronouncedly in a more intensified way, which were very less intensified in the beginning, or he didn't had felt those symptoms very strongly. So let it not be objected that the accessory phenomena and new symptoms of this disease that now appear should be laid to the account of the medicament just employed. So he's saying that we do not object to this thing, and it should not be objected that these accessory symptoms or the new symptoms which have come, they basically belong to the medicine, and they have come because we have employed this medicine. We have given this medicine, and that is why these symptoms have come. There is no doubt in that thing. So he has cleared that thing already, so that this thing does not confuse you in the how we have to go ahead. They owe their origin to it certainly, but they are always only symptoms of such a nature as this disease was itself capable of producing in this organism. So now here he adds something to that. He says that okay, they came because we gave the medicament, we gave that medicine, but the body was in a state of lack of reaction at that time. The body was not able to produce or tell in a greater way how it is feeling, what are the sensations, what are the functions which are impaired. So this medicine helped to bring out that picture of the disease for us. So all those symptoms which are coming or which are we are seeing after giving this medicament, yes, they appear, they belong to the medicine, they belong to the action of the medicine, they have come after the employment of that medication, but they are the symptoms which the disease was itself capable of producing in the organism also. Otherwise they could not have come, and which were summoned forth and induced to make their appearance by the medicine given. So they came because this medicine helped in reducing that lack of reaction. It reacted. Now the organism is reacting. This medicine made him to react. And now with that reaction, he is showing, the organism is showing, the man is showing that where he is diseased actually, owing to its power to cause similar symptoms. In a word, we have to regard the whole collection of symptoms now perceptible as belonging to the disease itself. So in these cases of one-sided cases, when such a state happens after the medicine, many symptoms come up. So these all symptoms, they basically belong to the disease itself. Many times when a patient is in a very weakened state, like in some organic disease, the disease which is acting upon the organs, and you give some medicine to bring him out of that lack of reaction, some carbovet, some sulfur, some opium, or any other remedy which basically is similar to that state which he is going through. The symptoms, they start increasing. The patient, okay, he complains about it that I didn't have these symptoms after the medicine, as before taking your medicine, but now they are increased. But that is an opportunity for us to understand this thing, that now I can give a medicine in a more clearer way. Now I can actually see what is happening, what is going on inside the body. So this kind of thing should not be taken as an aggravation. It is more of a clarity which is produced to us. It is a way of the vital force telling us, okay, these are the places or these are the things which are altered, or the sensations or the functions, they are altered, and give a medicine which is similar to this state, and the patient will get cured. Because now the disease is perceptible to us. Earlier it was in a state of latency. It was just showing some general symptom of weakness and not able to produce a complete reaction which it should produce. So as the actual existing condition, and to direct our further treatment accordingly. So we will take this symptom, this new symptom which have come up. Some are new, some is basically part of the old disease which were not perceptible, which were less in intensity, but now they are more in intensity. Many times this happens in the cases where the patients are suffering from some kind of schizophrenia or some kind of psychiatric diseases. Many times after giving a remedy which might be partial, some physical ailments, they come up, and that is a very good sign, because the body is showing that these symptoms are very less perceptible, but this is from where the disease has transferred to the mental disease. And now we should consider these symptoms and give a medicine more accordingly. There's a footnote to Aphorism 181. This is a footnote to this word. New symptoms of this disease that now appear. So he's saying that if the symptoms are not produced because of the error in the regimen, a violent emotion, or some tumultuous revolution in the organism, such as the occurrence or cessation of the menses, conception, childbirth, and so forth. So as I have said, that Dr. Hahnemann is very careful. He's a very careful person. He will give you each and every scenario which you have to consider. So he's saying that, okay, all these changes, patient was in a latent stage. There was a stage of lack of reaction. He was not showing much symptoms. It was a one-sided disease. But suddenly the symptoms start coming up. So he says that after giving the medication, you also have to take a note that these symptoms are not coming out of these. Something like this has not happened, that some violent emotion came or some other kind of error in the regimen. For example, he had eaten a lot, or there was some overexertion in his this routine, or some other kind of acute something which happened to him, or cessation of the menses suddenly stopped, or there was conception, or some childbirth was there. So these are the other events which can cause a person to come out of latency and show some symptoms. So we have to compare that nothing like this has happened, and then we can be very sure that these are the symptoms of the original disease which are being shown out, because now that lack of reaction is broken, and this medicine which we have given, it is basically trying to help us, trying to show us a more complete picture of the disease. Thus, the imperfect selection of the medicament, which was in this case almost inevitable. So we have selected an imperfect medication. We know that. But in such cases where the symptoms are not there, it is inevitable. We can't do anything about it. We have to select a medicine which is as perfect as to the situation in front of us. So in this case, almost inevitable, owing to the too limited number of the symptoms present, serves to complete the display of the symptoms of the disease. But it still served us, it still helped us in a way that it brought us the symptoms which were hidden inside. It brought out those symptoms. So many times the patients, they come and they ask, doctor, I have heard that when you take a homeopathic medicine, it will bring out the symptoms. Bring out the symptoms when they are in this stage of latency, in this stage of lack of reaction. Otherwise, if there are already symptoms which are brought out, the patient is already suffering from many things, then it will not bring out something new. It should not bring out something new. Then if it produces some kind of new symptom, or new this thing, or it aggravates something, then that will be because of the wrong medication we have given. So in that case, it is not a blessing in disguise. In this case, it is a blessing in disguise, because yes, imperfect selection was there in this case, but there were not too much symptoms. So this helped in facilitating or bringing out all those symptoms so that we can choose a right remedy now. So we have to understand both these scenarios are different, and we should not get confused in it. And in this way facilitates the discovery of a second, more accurately suitable homeopathic medicine. So it will help us. In this way, it helps us to find a more suitable homeopathic remedy. So whenever, therefore, the dose of the first medicine ceases to have a beneficial effect, in these cases, beneficial means the symptoms have come out, the symptoms have come up. If the newly developed symptoms do not, by reason of their gravity, demand more speedy aid. New symptom means the accessory symptoms. The accessory symptoms are not very grave. Okay, they should never be grave. Grave means they should never be violent. They should never be so violent that they are affecting the health of the patient, deteriorating him. And it never happens if we are giving very minute dose of the homeopathic medicine. If we are giving very small dose of the homeopathic medicine, this will never happen. If the newly developed symptoms do not, by reason of their gravity, demand more speedy aid, if they become grave because of the large doses, then our whole concentration will go to those symptoms that we have to, kind of relieve these symptoms where the antidotes come in. So all that theory of antidoting the remedy, it came because of this over or large doses, overly prescription of the doses or the large doses. So that is why they started needing an antidote for that thing. Because when you will give a medicine, for example, Lyco was given, the Lyco's symptoms or the accessory symptoms are so violent that you had to antidote those things. So in that thing, the whole picture was lost. Because in such cases, when you want the expression of the disease and then you get some symptoms which you need to antidote, then the whole picture is lost in between. But here also he is saying that it will never happen, which however from the minuteness of the dose of homeopathic medicine and in very chronic cases, the cases which are very chronic, is excessively rare. It is very rare phenomena that it would happen. A new examination of the disease must be instituted. So what we have to do is, when this symptom comes up, we have to start examining the disease. We have to take the case again. We have to see for more characteristic symptoms. It must be instituted. The status morbi, as it now is, must be noted down. So however this is the state of disease in front of us, it should be noted, and a second homeopathic remedy selected in accordance with it, which should exactly suit the present state, and one which shall be all the more appropriate can then be found as the group of symptoms has become larger and more complete. So we'll take the case again. We'll see what characteristics we have found after this thing, and we will find a remedy which will be more closer to this part. In cases where the patient, which however happens excessively seldom in chronic but not infrequently in acute diseases, feels, yes, and this was the scenario which I was talking about, that Dr. Hahnemann will tell us about this. So in cases, it happens very occasionally in chronic diseases, but yes, still can happen in acute diseases, that there will be some patients who feel very ill. They feel that they are very ill. Like I told you about that lady, that she was, I am feeling ill, I am having weakness, but we could not find any cause of the weakness. There are no other symptoms which can tell us about why she is feeling like this. Although his symptoms are very indistinct, the symptoms are not very distinct, they are not very strong symptoms other than this feeling that they are ill. So that this state may be attributed more to the benumbed state of the nerves. So this state happens, like I told you, that lack of reaction. There is benumbed state, a numbed state of the nerves, that they cannot tell or they cannot come out with the exact sensations, exact particularities, exact information that how they are feeling, which does not permit the patient's pains and sufferings to be distinctly perceived. So because of this benumbed state, the patient is not able to understand how he is feeling, where the pains are, what kind of pains they are, whether they are pains or weakness or some other kind of irritation. They are not able to understand that thing. So this torpor, this is a state of torpor. This torpor of the internal sensibility is removed by opium. So many a time, that is why opium is a very good remedy where this kind of lack of reaction occurs. And I have given to that patient opium, the example which I was giving of that lady who was feeling weakness. And in its secondary action, the symptoms of disease will become more distinctly apparent. And it happens in these cases who have been, patient have been suffering chronically from a long time because of some kind of medicines they have been taking, because the disease is progressing in a very slow way. So they go into a state where the disease becomes one-sided. There are no clear, distinct symptoms. Patient cannot tell us about it. We cannot observe it more clearly. So in those states, we have to give a remedy which can bring out the symptoms of the patient. But don't think only opium is the remedy for these kind of states. There are many remedies depending upon what kind of symptom or small symptoms or less intensified symptom the patient is suffering from. So in like manner, after each new dose of medicine has exhausted its action, the state of the disease that still remains is to be noted anew with respect to its remaining symptoms, and another homeopathic remedy sought for as suitable as possible for the group of symptoms now observed, and so on until the recovery is complete. So everywhere time we have to see whenever the action of the remedy is exhausted, when the remedy has worked completely, we have to again take the case, we have to see the symptoms and then prescribe accordingly in these kind of diseases. So this is about the a general picture of the one-sided diseases. In the coming aphorisms, there will be two portions of one-sided diseases. Like first will be the local diseases in the form of skin, then there will be the mental diseases which are acting on the organ of the mind. So in those two particular parts, Dr. Hahnemann will give us more guidelines in how to deal with those things. But this is a general outline of how we have to go when the diseases are one-sided, where the symptoms are very few and we could not get to a remedy because the symptoms are very few and not much characteristic. We don't have much characteristic in them. So we will stop today at aphorism 184, and in the next time when we will meet next week, we will start with the local diseases. So these are the two scenarios which should not be confused. One where Dr. Hahnemann had few remedies. I am saying Dr. Hahnemann, not us. Dr. Hahnemann had few remedies, which is given in aphorism 162 onwards. And then where the symptoms are few, that is a completely different picture. Okay, so we have to be very clear where we are standing in all those things. So again, with that, I will again urge you that during the week, just go through these aphorisms, try to understand this distinction between these two scenarios. And again, if there is some problem, if there is some question, some query, anything which you want to discuss or which you want more clarity on, just let me know and we can talk about that thing in the next class before starting the Organon part. So with that, I will take your leave. Thank you. Good night and enjoy Organon. Thank you.